Hey, Makata, it's so nice to see you.
Same. How are you doing?
I'm doing well. How about you?
I'm all right, just a little frustrated. My family and I have been having a hard time figuring out our health insurance, and we could really use some help.
I'm sorry to hear that. Figuring out health insurance plans can be really difficult and stressful, especially when you're looking for coverage for you and your family. If you'd like, I'm happy to answer any questions you might have.
That would be great. I've been looking into Medicaid and Obamacare, but I'm having a hard time deciding on which one I should apply for. Can you please explain to me the difference between the two?
Sure. The first thing to understand is that Medicaid is a health insurance program for low income individuals and families. It's a public assistance program provided by the government, kind of like food stamps. Obamacare, on the other hand, is not public assistance. They are plans that are offered by private insurance companies and are not run by the government. Instead, what happens is that the government provides assistance to help cover the cost of private insurance plans.
Hmm. So, which one is better?
Well, it depends on what your needs are and what you are eligible for. Medicaid has some services that they have to provide, like general doctor services, family planning, and lab and x ray services. But each state also has the ability to add more services to their Medicaid plans if they'd like. Obamacare also covers a wide range of medical services, such as emergency services, prescriptions, and mental and behavioral health treatment. Medicaid is generally cheaper than Obamacare plans, but it's also more difficult to get approved for. For both programs, the amount of assistance you get depends on your household income.
I see. So, what do you need to be eligible for Medicaid and Obamacare?
Well, since both programs have plans and requirements that vary from state to state, you have to be a resident of the state where you're applying for health insurance. You also need to fall within a certain income limit. Different states have different income requirements for different Medicaid programs, but all the states look at the federal poverty line to determine their income requirements. If your state has expanded Medicaid, then in order to meet the income requirement, you need to make no more than 138% of the federal poverty line. So for example, let's say you live alone in Maryland. Since it's just you, your household size is one person. So in order to meet the income requirement for Maryland Medicaid, you would need to make no more than 138% of the federal poverty line, which is basically $17,774 per year. But also, remember that some states have different income limits for different Medicaid programs. So for example, in Virginia, there is a Medicaid program for children called FAMIS, and the income requirement for FAMIS is 148% of the federal poverty line.
Okay. What about Obamacare?
Obamacare has a much wider income requirement, so more families are more likely to meet them. To meet the income requirements for Obamacare, you should make no less than the federal poverty line and no more than 400% of the federal poverty line. If you don't have an income and make less than the federal poverty line, you should probably apply for Medicaid instead. So for example, let's continue with our previous example of you living alone and having a household size of one person. In order to meet the income requirement for Obamacare, you would need to make between $17,774 and $51,520 per year.
You know, I'm wondering what happens if I believe I'm eligible for Medicaid and then apply, but for some reason I get denied. Will that mean I end up without coverage?
Oh no, absolutely not. If your Medicaid request is denied, it will be automatically sent to the marketplace to see what options might be available for you in Obamacare. But please remember, once you apply, you have to be responsive to any questions you may be asked and be ready to provide any additional documents that are requested. So make sure to look out for correspondence from the relevant agency you applied with.
I see. Do you need to be a US citizen to be eligible for Medicaid or Obamacare?
US citizens and green card holders can be eligible for Medicaid and Obamacare. Some states require that you be a green card holder for 5 years before you can apply for Medicaid. But there are exceptions for refugees and asylees.
And what happens if someone is not a US citizen or a green card holder?
Well, some non-citizens can be covered for emergency services. I would also recommend checking your state to see if they offer alternative options. In DC, there is a locally funded program called Alliance that provides medical assistance for residents who don't qualify for Medicaid or any other health insurance. This includes undocumented residents.
Mhm.
Alliance covers doctor's visits, preventative care, pregnancy care, prescriptions, lab services, medical supplies, and dental services. If your state doesn't provide programs like Alliance, I would recommend looking up local clinics in your area that might provide low-cost health services.
Yeah, I heard that if you apply for public assistance, it can affect your immigration status. Is that true?
Nope. I think what might be causing some concern is the public charge rule. What the rule says is that if someone is likely to have to mainly depend on the government for public assistance, their application for a green card may be denied. However, applying for Medicaid will not pose a risk to your immigration status. It is also important to know that any information you provide while applying for these benefits will only be used for the purpose of figuring out whether you are eligible or not. It will not be shared with ICE or other immigration enforcement agencies.
Okay, that's good to know. I'm also a little confused about the deadlines. It feels like there are so many dates to memorize. Is January 15th the absolute last day to sign up for health insurance?
Well, that depends on where you live and what healthcare plan you apply for. You can apply for Medicaid at any time of the year. As for plans under Obamacare, there is a certain period of time in which to apply. It's called open enrollment. Open enrollment starts in all states in November. In Virginia and Maryland, open enrollment ends on January 15th. In DC, it ends on January 31st. But there are some exceptions that will allow you to apply for Obamacare healthcare plans outside of the open enrollment period. We call this special enrollment. Qualifying life changes include becoming a US citizen, having a baby or adopting, getting married, getting divorced, changes in your income, and losing your healthcare coverage or expecting to lose your healthcare coverage within 60 days. So, for example, let's say we have a single woman who is pregnant during open enrollment, but she doesn't sign up for health insurance. Let's say she then gives birth on March 20th after open enrollment has already closed. Even though open enrollment is over, she can still apply for health insurance through Obamacare because her giving birth is a qualifying event for special enrollment.
Hmm. You know, my brother is back from college and he's living with my parents. Should my parents try to include him in their insurance plan, or should he just sign up for his own health insurance?
Well, it depends. How old is your brother?
He's 19 years old.
Ah, okay, in that case, he should apply for himself. If he was 18, then your parents could apply for him as part of their household.
The other thing that has been worrying us is that my father heard he's not eligible for Medicaid because he just turned 65 years old. Is that true? And if that's true, what options do you think he has?
So it's true, the cutoff for Medicaid is 64. So if your father is 65 years old, he may be eligible for Medicare instead. It's a program for people who are 65 years and above and for people with disabilities. Fortunately, a lot of states make it easy to apply for different healthcare programs on the same portal. So he can probably apply for Medicare through the same portal he would use if he was applying for Medicaid.
Oh, and what if we have some medical bills before enrolling for healthcare?
If you have prior medical bills, you should indicate that in your application and it could be considered in the coverage. But be prepared to provide documents that show your income at the time, when the care was received, what care was received, and how much you were charged. Also, if you are approved for Medicaid, the coverage starts on the first day of the month when you applied. So for example, if you applied for Medicaid in the middle of January and were approved at the end of January, your coverage would technically start on the first day of January. You can also ask for Medicaid coverage to apply almost 3 months back if you had medical expenses during that time. But this only applies if you would have been eligible for Medicaid in those 3 months. Obamacare coverage unfortunately does not work that way. If you signed up for Obamacare between November and December 15th, then your coverage would start on January 1st. If you apply for Obamacare between December 16th and the end of open enrollment, then your coverage wouldn't start until February 1st.
Okay, that answers my question. I have another one. My sister already has health insurance, but she's not happy with the coverage she's getting. Moreover, the price is just too much for her to afford. What advice do you have for her?
If your sister is not happy with her current plan, I recommend she shop for a better option in the marketplace. Plans and prices change every year, and her situation might also change. So if she shops around in the marketplace before open enrollment ends, she might be able to find a plan that fits her current medical needs and her financial situation.
Hmm. I can also use your advice on another issue as well. My cousin is undocumented and she does not have health insurance, but we are very worried about her because she's currently pregnant. She's not seeing a doctor for prenatal visits, and she's very worried about the amount of money she might end up having to pay for the hospital when it's time for her to deliver the baby. Is there any option for her to get coverage?
So, unfortunately, most undocumented people are not eligible for Medicaid or Obamacare. However, pregnancy does create a special circumstance. If your cousin is pregnant, she should apply for Medicaid and she will be granted coverage from the month she applied until 2 months after delivery. She won't be asked for documentation or a social security number. The coverage will include a doctor's visit and all the necessary screenings, such as ultrasounds, medication, and any prescriptions she might need during pregnancy. So please tell your cousin there's no need to stress. All she needs to do is apply.
Ah, this is very helpful information. I feel much better knowing that we have options to explore. But I'm still a little worried about something. I do not have a lot of experience making online applications. This is very important, and I'm concerned about what would happen if I don't understand something in the application, especially since there's so much information to take in. And of course, because me and my family are from another country, there's always the language barrier.
Yeah, that's a common concern for most people. But don't worry, there is a solution for that. There are trained assisters in every state that are ready to help you with the application over the phone or in person. The best part is you can actually get assistance in your own language, so you don't have to worry about the language barriers. If someone has a limited English capacity, it's better to call in and request assistance in your language. Just be ready to provide the necessary information like your full name, social security number, proof of income, so maybe through a pay stub or a W-2 form, and if applicable, your current insurance policy and the type of insurance that may be offered by your employer. And of course, if you have family or friends in DC, Maryland, or Virginia who need assistance with healthcare enrollment, please let them know that they can call African communities together and request assistance. We try to provide assistance in commonly spoken African languages, and we know it may be more comfortable to speak with another African about some of these issues. We can be reached at 202-834-3595 or 202-870-4926.
Thank you, Sose. You know, I almost gave up signing up for health insurance. I thought it was too complicated, and I even thought some of my family members and I may not be eligible to get coverage. The information you provided helped me understand the requirements and the application process.
I completely get it, and I'm so glad our conversation helped. The entire process can be really confusing and frustrating, so a lot of people don't even bother to apply. The fact is, you never know what you're eligible for until you apply, and there are people out there who are willing to help if you run into any trouble. I encourage you to take advantage of the open enrollment period and apply for coverage.
I definitely will. Thanks again.
You're welcome.